has had an enormous impact in my practice. We have a community practice with cardiologists, and here in Red Deer, Alberta, we deliver consultation, follow-ups, and stress tests out of our office. And those reports, prior to CII, would sort of just go out into the ether. They go back. A copy would go back to the family doctor, but there'd be no copies anywhere on Alberta Netcare. And if the patient went into the emergency department, they would not be available. So we implemented CII probably last fall, and it's been a tremendous help. We have had a patient in particular from one of the rural communities here in central Alberta, who was referred by his family doctor to see me in the office for, I think it was exertional shortness of breath. The patient had a workup at the office, found to have severe aortic stenosis, was further worked up, and I attended the conference call when you figure out how to fix someone's valve, where you figure out what the game plan is to fix someone's valve. And the plan was, after discussion, the patient would have a TAVI valve. That's a valve that's fixed through a less invasive procedure through your leg, as opposed to doing an open heart surgery. So that was the plan for this patient, and the patient came to see me in follow-up, and we documented that was the plan, and it was going to take 3 to 6 months to get done. So that was fine, and the patient went home. Now, several weeks or maybe a month or two later, the patient ended up back in a rural emergency department complaining of acute onset shortness of breath. And in fact, it was in pulmonary edema. So this patient then, the family doctor or the doctor that was covering the emergency department in this rural hospital, then just went in and went into Netcare, looked up the patient's information, and saw the consultation and saw the follow-up note that said the plan was, the diagnosis was aortic stenosis, and the plan was to have a TAVI valve in 3 to 6 months. Then, using that information, then they were able to quickly figure out what to do for that patient, that then and there, and moreover, they were able to contact me in Red Deer, and we were able to get that patient transferred in, and from there we sort of optimized the patient medically, then contacted the facility in, I believe it was Edmonton, to get that valve procedure expedited. So then the patient, shortly thereafter had that valve fixed and is now doing fine. The advantage that this had in this scenario was, if the emergency doctor in this rural community didn't have that patient's information on Netcare, and nowhere else on Netcare was that information documented, that the plan was to have a TAVI valve, and that the wait time was going to be 3 to 6 months, etc. If the doctor didn't have that information, then it would have not been quite as smooth. The doctor may have been able to reconnect the dots, and likely would have in due course. However, the question is would the patient have been really managed as quickly, and how many more hospital bed days would have been consumed? And would the patient outcome have been as good? I mean, part of the situation is when you have someone who's deteriorating is that really we need to get moving on them, and the fact that everything was able to happen quickly because we had a good sharing of information was particularly important. So I think there's unequivocal benefit of CIH for this particular patient, and to many of my patients and patients in my practice here in central Alberta. So certainly thanks to AMA and to I guess Alberta Health for organizing this and making CII happen, because it's certainly a very useful tool.